A Brazilian butt lift, or BBL, is a buttock augmentation procedure that takes unwanted fat from other areas of the body to lift and add volume to the buttock. The BBL procedure typically involves liposuction to remove fat from the donor sites. Then, the fat is purified and reinjected into the buttock area. The procedure aims to create more rounded and shapely buttock, as well as improve the overall proportions of the body. The most common donor sites for fat are thighs, stomach, and back. However, fat can also be extracted from the arms, knees, and ankles. Good candidates for BBL surgery are those who lead a healthy lifestyle, don't smoke, want to reverse natural sign of aging such as sagginess, are looking for more rounded, shapely buttock, have extra fat elsewhere such as stomach, thighs, and hips. Recovery time after Brazilian butt lift can vary depending on the individual case and the patient's overall health. Typically, it can take approximately 6 weeks to recover from a BBL. The first 2 weeks, you will need to avoid sitting and laying on your backside. Most patients can begin light activity in 7 days, but to do advanced exercises, you have to wait until 6 to 8 weeks after surgery. Typically, I advise to avoid sitting or lying on their buttocks for at least 2 or 4 weeks after the procedure. During this time, you will need to use special cushions, such as a donut cushion, to avoid putting pressure on the buttocks when sitting. After the first 2 to 4 weeks, you are allowed to sit for brief periods of time. But it's still important to avoid prolonged sitting or lying on the buttocks for several weeks to months after the procedure. I generally recommend avoiding hard exercise for at least 2 or 4 weeks after Brazilian butt lift. This is to allow the transferred fat cells to settle properly and to prevent any damage or bleeding. The results of a Brazilian butt lift are long-lasting. Some of the transferred fat cells will be absorbed by the body initially, about 30 to 70%. It depends your surgeon technique and your lifestyle, as whatever you eat or not eat. And the remaining fat cells may shrink or expand over time due to weight changes, aging, or other factors. There are 2 primary options for people looking to improve the appearance of their buttock. A Brazilian butt lift or butt augmentation, both procedures involve the use of implants. A Brazilian butt lift involves shifting fat from other areas of the body to the buttocks, while butt augmentation involves the placement of artificial implants. Also, Brazilian butt lift is typically less expensive than butt augmentation. Recovery times also vary. A Brazilian butt lift usually requires about 2 weeks of downtime, while butt augmentation may require 4 to 6 weeks. Sleeping on your stomach is the best way to sleep while recovering from BBL surgery. But it's possible to sleep on your back by using pillows propped against your lower back and thighs to take pressure off. There is nothing risky about pregnancy or having kids as long as you have fully recovered.